Hi there. We're going to continue with the program handbook walkthrough. This next section pertains to the grading policy, some things you need to know for this fall semester, but also quite a few things before you go into clinicals in the spring semester. So just looking here, the program grading policy, you'll see 90% to 100% or more is an A, 80% to 89% is a B, 70 to 79% is a C, 60 to 69% is a D, and unfortunately anything below 60% will be considered an F or a failing grade. Please keep in mind that a grade of a C or better is necessary in order to pass to successfully complete the ophthalmic technology program, and in fact a C is required this fall semester, your average, in order to be able to proceed on to clinicals in the spring semester. In the clinical practice, a lot of people have a lot of questions about that. You will have a clinical site coordinator who will help you to identify program sites that will host students within their practice. And we will certainly try to keep in mind your geographic location, although because we are contracted with certain facilities, our choices are a little bit limited, but we will do our best to match you with different rotations that will match your interests and as well as some geographical needs as well. However, keep in mind, we will only do our best. Please note that most practices have hours Monday through Friday. Some may have Saturday hours, some may have evening hours, but the goal is to get about 480 clinical hours. Please note that this internship is a non-paid position, so you will be spending time as your college coursework is actually your clinical hours. And we'll talk more about that as we go along. Before you are placed, you will be discussing that. Your clinical site coordinator will work with you on that. Clinical requirements, please read through all of these. I'm not going to go through all of these verbatim, but you will see there are several physical activities or requirements that are needed. In other words, you need to be able to move around, work with patients, work with the fellow technicians and doctors, and get some things done. There is some lifting involved and things like that. Data conception, to be able to compare and or read printouts and orders and be able to document as well. Interpersonal communication is certainly very important as we work with patients and doctors and fellow technicians and things like that. Hold on a second, I clicked too far there. Language ability, certainly able to comprehend a variety of documents, reports, and books. Prepare your documents as you're taking medical histories and documenting the results of your exams and things like that. And also be able to prepare and communicate with fellow folks in the workplace. Intelligence is needed. Of course, we go back to that critical thinking that we mentioned in an earlier section in order to problem solve and be able to accomplish the task asked of you. Verbal aptitude, we certainly need you to be able to communicate with your patients and fellow coworkers in a way that captures important information in a way that is able to document that as well. Numerical aptitude, as we spoke earlier, there's certainly a little bit of math involved with ophthalmology, so we want to make sure that you're able to complete that. And then as far as form or spatial aptitude, in other words, making sure that things kind of make sense and are appropriate and proportional and things like that. Manual dexterity, there are a lot of tiny instruments that we use in ophthalmology, and we want to make sure that you do have the manual dexterity to be able to hold and manipulate and use those instruments as well. Physical communication, again, ability to talk and to hear and to understand various types of nonverbal communication as well as verbal. Personal traits that we're looking for, looking to be able to build strong working relationships, demonstrate professionalism and courtesy, maintain confidentiality that is paramount. It's not just a nice little guideline, it's actually a federal law that we keep patient information confidential. So that'll be something that we really do strive to achieve. Demonstrate neatness and good hygiene. We're going to talk about that more when we get into clothing and what to wear into your clinicals. A positive attitude when receiving feedback. As you're learning and you're going to different clinical sites, as students, A lot of mentors are going to be working with you and making suggestions on ways to improve. Some of those suggestions may seem to counter one another or be a little bit contradictory to one another, but take it in, be respectful, and then perhaps talk to your mentor, your clinical site coordinator, or one of your instructors, or speak to me if you like, if you have some things that seem confusing to you, or maybe you're receiving information that seems to contradict one another. As far as travel, we want to make sure that you are available to travel, because you are responsible to getting to and from college campus for the labs, as well as getting yourself to clinicals. Also want to make sure that you're bringing snacks or lunch or both during your clinical time, so that you don't need to leave the facility. Okay, seems like I skipped one up here. One thing that is really important, that you're physically comfortable touching others, because like we mentioned, you're putting eye drops in, you're doing procedures on the eye. That's a very sensitive area for a lot of people, and so we want to make sure that you feel comfortable being able to touch someone's eye or face or around the eye. Okay. As we move on, criminal background checks, drug screens, and health requirements. So someone's going to be contacting you. The clinical compliance coordinator will be contacting you. I believe that's going to be Angie Lust this year. So if Angie hasn't contacted you already, she will be. And she's going to go through what's called Castle Branch, which is a third-party organization that helps to track all of the things that you will need to complete before you're eligible to go into the clinical situation. Not for labs, but for the clinics in the spring. So we have all this semester to prepare you to get all that background information ready to go before the spring. I do not claim to be an expert on what all Castle Branch entails. Just know that there are drug screens, some vaccinations that are required, CPR and basic life support certification that's required, and several other things. So we will get with you on that in more detail. Okay. So here is the CPR BLS certification. If you need assistance in finding a place that provides that, let us know, and we can find a place that's local to you, and make sure that it is American Heart Association BLS for healthcare providers. There are several different layers of CPR and BLS certification. We just want to make sure that you get the right one so that it is sufficient and meets those requirements. Okay. Last thing here, when you're going into clinicals, we want to make sure that you adhere to the dress code, not only for Mercy, but also be aware of any dress code policies that that particular facility has. In other words, as you go into a private practice or an academic practice where they're doing ophthalmology, you want to make sure that you're adhering both to Mercy guidelines as well as the facility guidelines. They're probably going to be very similar, but if there are any differences, make sure you follow the policy that's the most conservative so that you are compliant with both. Typically, the clinical dress code are black scrubs, so that's a black scrub top and black scrub bottoms. If you wish to wear a lab coat, that is fine too, but we typically recommend that that is black as well so that it goes along with the scrubs. You will be issued a Mercy College student ID. You will be required to wear that in the time that you are in your clinicals. Make sure that as you wear your student ID badges, they're worn from the waist and above. So that doesn't mean hooking it to your waist or to your pocket or to your shoe or wherever. We want to make sure that it's visible and people can actually read your name tag and know who you are and identify you as a student, and not misidentify you as an employee or a doctor or a technician at the practice. I want to make sure that you're in a clean, neat, professional appearance. Wear appropriate uniform shoes as described above. Makeup should be natural looking and professional, as should hair. Hair should be in a normal color, not green or purple or bright hot pink or something like that. And jewelry should be conservative. Facial or oral jewelry must be removed. Tattoos should be covered. Nails should be clean and appropriate length. Keep it in mind that we do use our hands to touch the face and the eyes of our patients. We want to make sure that your hands are clean and professional looking. And one more thing to just keep in mind is that chewing gum is inappropriate. And so while you may need a breath freshener, that's fine, but with patients, you need to remove the gum from your mouth. Okay? Clinical timekeeping, we want to make sure that students are expected to validate their clinical attendance, so you will be provided with some type of documentation. In other words, you can maintain the hours and capture the number of hours that you have worked, also capturing some of the skills that you're practicing or being introduced to each day. If you're going to be absent or tardy, you want to make sure that you let the clinical site coordinator know that, and also notify the person on site at that facility where you are doing your clinicals, so that they are aware that you will not be there as well. And certainly things come up, bad weather, illness, family emergencies. We understand that, but we do want to make sure that you notify the proper people, so that we're not worried about you or concerned about where you are. But we also want to track your hours, because those hours that you have missed we'll have to make up somewhere else, and get creative with that perhaps in some instances. Clinical evaluation and grading. So certainly, we're going to track your progress, make sure that you're doing well. We want to make sure that you maintain a professional and courteous demeanor while in the practice that you're doing your clinicals. And we will work with that site supervisor and your clinical site coordinator in making sure that that is all happening. Okay. Some other things to think about is, if you are not performing to the standards recommended and outlined by Mercy College, or if the practice itself is finding reason that you are not upholding your end of the deal and behaving and performing at the level they expect, there may be a time that you may be excused from that clinical site. We will try our best to find you another clinical site, but make sure that you understand it is your responsibility to show up on time, to follow instruction, to be ready to go as required and outlined based on your schedule and the understanding that you have of the clinical time. So make sure you look through that, okay? Service work policy, there is no stipend, I've said it earlier, but there's no stipend paid to the ophthalmic technology students while you're completing your clinical hours. I know that's a lot of work on your end to not be paid for it, but just remember that this is part of your college experience, and it's a very valuable college experience because we're getting you into real ophthalmic practices. They are doing us a service by allowing you to be there, to be with their patients, to be with their doctors and their technicians, to be able to use their equipment to gain that experience. It's a really valuable time, and we want to make sure that we respect that time and get those clinical hours in. Okay, so even if you're offered a job, if you're the super tech and they want to hire you right away because they're just in love with you, which is likely to happen, just know that you can be hired at a position before you've completed your clinical hours, but your clinical hours are unpaid, and so they are separate from any hours that you're working as a hired employee. So let's make sure we get your clinical hours completed first, and then figure out how to maneuver into paid working hours. And there's a fine line there, and we can work with you on that, okay? Just as a courtesy, anywhere you go, cell phones and calls during clinical experience, really keep an eye on that. Cell phones can be a real distractor for many of us, and we want to make sure that you put your cell phones away. Avoid texting or sending or receiving calls during your clinical time, because that time is there for you to learn, not to be on your phone excessively. We understand you may have family members or emergencies that come up, and we certainly understand you need to check your cell phone from time to time, but please make sure that it's put away, that it's not out during the times you're with patients or the time that you're learning. Please respect that time, that these clinical hours are learning time, and we want to be respectful of the mentors that you're working with. Hazardous materials, certainly in a medical environment, you may be introduced to medications, cleaners, other things that may potentially be harmful in the way of hazardous material. And so we want to make sure that you're aware of OSHA standards and things like that. So we'll go through that as well. Okay. Confidentiality. This is really important that we keep all the patient's information confidential, even if it's someone you know, even if it's somebody famous, even if it's your next door neighbor. It is critical, it is paramount that we keep patient information confidential. You cannot share any information outside the practice, and really even with others inside the practice, if there's not a reason for them to know the information. So let's make sure that we really keep confidentiality at a very high priority. After you finish the program, and really even before you finish the program, we're going to start talking about career opportunities. We will keep you posted and apprised of local ophthalmic job opportunities, and when you're in the spring semester, you'll actually in your capstone class in I-114 be looking